So yesterday's session was designed to introduce people to Ayurveda and find some hints for taking it into clinical practice. With the knowledge that in the last 10 years, most people have shied away from Ayurveda for a couple of reasons. One is that it uses compound herbal formulations, which are not the way that most Westerners learn about alternative medicines. A second is that the terminology in Sanskrit is very difficult for many mainstream people to understand. And a third is that people feel very wary because of these reports of heavy metal contaminations, and the way in which Ayurvedic medicines are made seems to be very unusual for them. It doesn't fit with their pharmacology paradigm. What was interesting yesterday, though, is that when I asked the question of how many people are familiar with Ayurveda, 2/3 of the hands went up, which instantly made me realize that my slides were perhaps too inappropriate. The second is that many people get compound formulations now because they're using them in clinical practice, and they just want to know, well, how shall I put these together? What are the tools for putting these together? And the third area where they don't know the terms of Ayurveda, there are a lot of people doing yoga. They get Sanskrit terms. They don't need to have translations of Vata, Pitta, Kapha. So I started at a slightly higher level, still went through the information, and moved right into a slide, which I was going to put at the end, but then I moved up, which was about assessment and teaching people how to take the Vata, Pitta, Kapha, take the and Agni, which is the residues and toxins in the body, which is quite prevalent in the US, and Agni, which are the fires in our body, and to understand the different fires in our body and the residues, how do we assess people clinically? I showed some questions from my intake form that I have in my office. And I put those together so that people can actually walk away with some clinical practice tools, some ideas of how to ask questions to their own body and to their patients, and how to take the basics of and Agni with a backdrop of Vata, Pitta, Kapha, understand the disease states and what their Vata, Pitta, Kapha is, which I think most people actually got yesterday. It was exciting. And then to put an algorithm to it and use that in clinical practice. And at the end, I did introduce some herbs, but I was pretty sure that most people have already seen the herbs. And the main part of my talk, actually all of my talk, is in the slides, which are in either online or in the books that people got. So they can go through the slides and really have a chance to absorb them and peruse them and see what kind of questions they have. And if nothing else, they can go to dinacharya.org or to my website and they can get more information. So that's a pretty good.
Tell a little bit about some other offerings that you're bringing to the world in terms of people who are more interested in going deeper into Ayurveda?
Yeah. So I'm a holistic doctor. I focus on Ayurveda because it's a comprehensive, holistic, ecologically sustainable system. And I found it to be much easier for me to use it than any other system that I've worked with. So I've trained in several different systems, and I tend to use them sometimes, but I tend to use a lot more Ayurveda now. And so the resources that I provide, so I gave a few websites on where to buy herbs so we know that they're clean. I gave some resources about my school, Dinacharya Institute. So dinacharya.org is the website. And we have weekend seminars. Once a month we have a full weekend toward a certification course, but the modules can be taken individually. We have evening seminars, mostly at my clinic, sometimes at yoga studios around the city. I have teleconferences for people to learn. They can just call in. We have a medicinal plants course that's going on as a teleconference, so for people to be able to understand herbs and spices. And then I give a lot of lectures, both throughout the United States and in India. And my work in India helps the people of India who don't know Ayurveda to learn Ayurveda. There's a lot of allopathic doctors that don't like Ayurveda in India. But it also helps the Ayurvedic doctors to learn about modern medicine. And that's a very exciting place where we've got Ayurvedic doctors in India wanting to interface with CAM doctors in this country. And I'm actually going to redo the fellowship that we did in 2009 and have another session of it this summer, starting this summer, where we have 15 doctors from the USA of different CAM modalities interface with 15 Ayurvedic doctors and have them calling each other once a month and see how that goes. And then the last thing is that I take students and patients to India every year. So we have 15 of us. We go in the summer and we experience Panchakarma, which is the very high-tech detoxification system that happens, and we get to watch ourselves change, and we get to watch the others change over a month of being in India and subjecting ourselves sacrificially to 2 hours of hot oil massage every day.
Thank you.
You're welcome.